Look at your tongue right now. Before you do anything else, walk to a mirror, open your mouth, and look closely at the surface, the color, the edges, the way it moves. Most people never do this. They brush past it every single morning, and yet, after the age of 60, the tongue is one of the most honest signals your body has. It can warn you of trouble in your blood, your heart, your nerves, and your immune system, often long before any other symptom appears. What I am about to explain is something most people only discover when it is already late. I am Dr. Hiroshi Nakamura, and after more than 25 years working with older adults, I have learned to look at the tongue the way an experienced sailor looks at the sky. It tells me what is coming. I have sat across from thousands of patients, and again, the tongue revealed something the patient had no idea was happening inside them. Today I want to teach you to read your own. What most people do not realize is that the tongue is not simply a muscle for tasting and speaking. It is rich with blood vessels, nerve endings, and a surface that renews itself constantly. Because it changes so quickly, it reflects the state of your body almost in real time. When something is wrong deeper inside, the tongue often shows it first. On the surface, this seems harmless. But inside the body, the tongue is acting like a quiet messenger, and most people are not listening. Let me walk you through the signs I look for, one by one. The first sign is a smooth, shiny, painful tongue. Normally, the surface of your tongue has a slightly rough texture, covered with tiny structures called papillae. These are the small bumps that give the tongue its grip and its sense of taste. Now imagine a patient who notices that their tongue has become smooth, glossy, almost polished, and often sore or burning. This is called glossitis, and in older adults, it is very frequently a sign of vitamin B12 deficiency. Here is the hidden mechanism. As we age, the stomach produces less acid, and the body becomes less efficient at absorbing vitamin B12 from food. This vitamin is essential for building healthy red blood cells and for protecting the nerves. When it runs low, the cells on the surface of the tongue cannot renew themselves properly, and the papillae flatten out. Think of a carpet that has been walked on for years, until the fibers are worn flat and the floor shows through. That is what is happening to the surface of the tongue. The consequence, if ignored, is serious. Low vitamin B12 does not only affect the tongue. Over time, it can cause numbness and tingling in the hands and feet, problems with balance, memory difficulties, and a deep fatigue that no amount of rest seems to fix. Many older adults are told they are simply getting old, when in truth, a simple blood test and a correction of this one vitamin could change everything. The second sign is the color of the tongue itself. A healthy tongue is a soft pink, but the color can drift, and each shade tells a different story. A very pale tongue, almost white at the body of the tongue, often points to anemia, a shortage of healthy red blood cells. In older adults, this can come from iron deficiency, from slow bleeding in the digestive tract, or again from low vitamin B12. A pale tongue paired with tiredness and breathlessness is something I never ignore. A tongue that looks unusually red and smooth can point to deficiencies as well, or to certain vitamin shortages. And a tongue with a bluish or purple tint is one I treat with real seriousness. This is the part that rarely gets explained. A blue or purple color can mean the blood is not carrying enough oxygen, which can be a sign of heart or lung trouble. In a person over 60, that color change deserves a conversation with a doctor, not a shrug. The third sign is a white coating on the tongue. Now, a thin white film in the morning is usually nothing to worry about, but there are 4 patterns I want you to understand. The first is a thick white coating that does not burn away easily and may be a fungal infection called oral thrush. This is common in older adults who wear dentures, who take certain inhalers for the lungs, who are on antibiotics, or whose blood sugar is running high. In fact, persistent thrush in an older person is sometimes the first clue that diabetes is present. The second pattern is white patches that you cannot wipe off and that have a firm, slightly raised texture. This is called leukoplakia, and it matters because in some cases it can be a precancerous change, especially in people who have smoked or used tobacco for many years. The third pattern is a temporary white coating from dehydration or mouth breathing during sleep. And the fourth is a coating linked to digestive sluggishness. The point is simple. A coating that comes and goes with your morning routine is one thing. A coating that stays, that thickens, or that you cannot remove is something to have examined. If any of this is sounding familiar to you, write the word tongue in the comments below. It helps me understand how many of you are noticing these signs and it may remind someone else reading to take a closer look at their own health. The fourth sign is dryness. So many older adults live with a constantly dry mouth and simply accept it. This is called dry mouth, and when it is persistent, it can be a sign of a condition where the immune system attacks the glands that produce saliva. But far more often in seniors, chronic dryness comes from medications. Many common pills for blood pressure, for mood, for allergies, for bladder control reduce the flow of saliva as a side effect. Here is why this matters more than people think. Saliva is not just water. It protects your teeth, it helps you swallow, it carries enzymes that begin digestion, and it controls the bacteria in your mouth. When saliva dries up, tooth decay accelerates, swallowing becomes difficult, and infections take hold more easily. Think of a river that keeps a valley green and alive. When the river runs dry, everything downstream begins to suffer. A dry mouth is not a small inconvenience. It is a change in one of your body's natural defenses, and it is worth reviewing your medications with your doctor to see whether anything can be adjusted. The fifth sign is swelling and the marks along the edges of the tongue. Look at the sides of your tongue. If you see scalloped indentations, like the gentle waves of a shell pressed into the edges, that often means the tongue is slightly enlarged and pressing against your teeth. An enlarged tongue can come from low thyroid function, which is very common as we age and often missed. It can also be linked to fluid retention, or in some cases to a buildup of certain proteins in the body. There is another reason this matters greatly in older adults. A larger tongue and the tissues around it can contribute to obstructive sleep apnea, the condition where breathing stops repeatedly during the night. This places real strain on the heart and brain over time, so an enlarged scalloped tongue, especially in someone who snores heavily or wakes unrefreshed, is a sign that deserves attention rather than dismissal. Now I want to tell you about a patient because his story shows how these quiet signs connect. I remember a man named Walter, 73 years old, a retired school teacher, careful and precise in everything he did. He came to me convinced his only problem was tiredness. He told me he had simply slowed down, that it was his age, but when he opened his mouth I saw it immediately. His tongue was smooth and glossy, the surface worn flat and pale at the body. With a faint soreness he had stopped mentioning because he assumed nothing could be done. What Walter believed was that fatigue at his age was normal. What he was doing wrong was nothing careless. He simply did not know that his body had quietly stopped absorbing vitamin B12, a common change after 70. What we discovered through a simple blood test was a significant deficiency, along with mild anemia. We corrected it with treatment and a change to his diet. Within a few months, Walter told me the fog in his mind had lifted, the tingling in his feet had eased, and he felt in his words like himself again. The tongue had been telling that story the entire time. He simply needed someone to read it. I share Walter's story because it is so ordinary. There was nothing dramatic about it, and that is exactly the point. These signs are quiet, and quiet things are easy to ignore. Let me mention a few more signs briefly, because they matter for your age group. A bright red, smooth tongue, sometimes called a strawberry appearance, can follow certain infections or point to specific deficiencies. Patches on the tongue that seem to move and change over weeks, often with smooth red areas bordered by white, are usually a harmless condition, but worth confirming. And cracks or sores at the corners of the mouth often travel together with the same vitamin and iron shortages we have discussed. But there is one sign I treat with the greatest seriousness of all, and I want you to hear this clearly. If you ever notice a sore, a lump, a thickened patch, or an ulcer on your tongue that does not heal within 2 to 3 weeks, you must have it examined by a doctor or dentist without delay. Most mouth sores heal quickly, but a sore that lingers, especially along the side of the tongue, can be an early sign of oral cancer. This risk rises with age and with a history of tobacco or heavy alcohol use. I am not telling you this to frighten you. I am telling you because oral cancer caught early is often very treatable, and caught late it is not. A sore that will not heal is not something to wait out. Now let me give you simple, practical guidance, because I do not want you to feel overwhelmed. Start with one habit. Once a week, in good natural light, look at your tongue in the mirror. Notice its color, its surface, its edges, and whether it moves smoothly and evenly. You are simply learning what your normal looks like so that you can recognize a change when it comes. Second, keep your mouth clean and gently brush the surface of your tongue when you brush your teeth. Third, Drink enough water through the day, especially if your mouth tends to feel dry. Fourth, if you wear dentures, clean them daily and remove them at night. And fifth, do not skip your dental visits because a dentist often sees these signs before anyone else. If you take several medications and your mouth is constantly dry, bring that up with your doctor. If your tongue is pale, smooth, or sore, ask for a simple blood test to check your iron and vitamin B12. These are not difficult or expensive steps, and they can change the course of your health. I want you to hear something reassuring before we finish. The body, even later in life, has a remarkable ability to respond when you give it the right conditions. Many of the signs I have described today come from things that can be corrected: a vitamin restored, a medication adjusted, a condition caught early while it is still small and manageable. You are not powerless in front of your own aging. You are simply learning to listen to a part of your body that has been speaking to you all along. Your tongue is a quiet messenger. It has no reason to lie to you. All it asks is that now and then you take a moment to look and to listen. If this was helpful to you, I would be grateful if you would subscribe to this channel and leave a like so that this guidance can reach more people who need it. Each week I share what I observe in my patients so that you can make better decisions earlier while there is still time to act gently. And tell me in the comments, when was the last time you truly looked at your own tongue? I read what you write, and your story may help someone else look in time.